Hi, this question comes from Natai. Natai is wondering what she can do. She has severe sacroiliac joint pain. Sacroiliac pain is extremely common. As a matter of fact, the statistics show that it keeps rising and rising and rising. More people are getting SI joint pain, and that's just short, and the medical terminology just says SI joint. Now, sacroiliac joint pain was one of my specialties when I was working with orthopedics and doing a lot of different types of therapies and really using advanced type technologies for SI joint pain. There's a few things in my experience that most people never look at and never work with, especially chiropractors or orthopedics, that I feel are one of the main causes for SI joint pain. First of all, when you look at the SI joint pain, you have to look at the hip joints, you have to look at the knee joints, you have to look at the ankle joints, and you have to look at the feet, the angles of the feet. What I found was in about 80% of the cases was that the feet were the main cause of the SI joint pain. So number one, when addressing SI joint pain, always get your feet measured. And I used a company called Foot Levelers. And in the United States, some chiropractors actually will be able to, our Foot Levelers specialists. You stand on a device. It takes a laser screen of the bottom of your foot, and it custom designs a orthotic for your shoe. Now, don't go to an orthopedic doctor and get some orthotics, because they never work. The only ones that ever worked for me were the ones that we specifically designed from Foot Levelers. That's step one, correct the feet. Step two with SI joint, work the muscles in and around the SI joint. Now there's two different types of therapies that I would use when I was doing that. One is called PNF stretching, Paul, Nancy, Frank stretching, PNF stretching. So if you're looking for a chiropractor and you have SI joint pain, make sure they do PNF stretching. And the second thing is ART. It's called active release therapy. Okay, PNF stretching and ART on the following muscle groups: the gluteus medius, the gluteus maximus, the psoas muscle, the piriformis muscle, the hamstring muscles on both sides, the right side and the left side. All these muscles need to be worked on the right and the left. And last but not least, the TFL, the tensor fasciae lata muscle. It runs down the sides of your leg. Okay? That's step two. Work all those muscles 2 or 3 times a week. Step three, if you need this, would be to get an SI belt. There's a special belt that you can get that goes around the hips, and it relieves the tension on the SI joint. Sometimes when you have a chronic inflammation, and even with walking, and you just keep rubbing and rubbing and rubbing, it's really, really hard to get that inflammation down. So in some cases, in severe cases, I would use an SI belt, and the patient would wear that SI belt for 6-8 hours a day while they're doing their activity, and it would relieve the pressure on the SI joint. Now, you can find SI belts online. Okay, so that would be step three. Step four would be evaluating your weight and your posture. You know, if you're overweight and your posture's sitting forward, it's going to put more pressure on the SI joint. So you really want to look at your posture and look at your weight and maybe get on a diet, eat some raw healthy foods. Step 5, cleanse, cleanse, cleanse. Do an intestinal cleanse. Do 3 liver and gallbladder cleanses. Pain is completely associated with toxins that get trapped into the muscle and into the nerve area. So it's a vital part for you to cleanse your body. Intestinal cleansing, number 1. 3 liver and gallbladder cleansings, number 2. Harmful organism cleanse, number 3. And chemical and heavy metal cleanse, number 4. Number 5, green living cleanse, cleaning up your environment. Last but not least, there are a few other tips that I've used to be successful. One is spinal decompression. Now, the machine that I used to use was called a DRX 9000. If If you have any further questions about spinal decompression, you can call our office 713-476-0016 and I can steer you in the right direction for those. Or another good thing that I've used is a inversion table. Inversion tables are just click your feet in and you hang upside down for 5, 10, 15, 20 minutes 3 times a day, and it stretches your spine and pulls on your spine and releases the pressure from the SI joint. Other than that, those are my recommendations. I hope that helps. Take care.